Advanced Practice Forensic Nursing, presented by Kelly McIntosh, Brittany Norman, Lisa Snyder, and Kimberly Wasson. What is forensic nursing? Forensic nurses investigate real and potential causes of morbidity and mortality in a variety of settings, collecting evidence from perpetrators and survivors of violent crimes, testify in court as a fact or expert witness, and bridge the gap between the criminal and healthcare systems. Qualified medical professionals that are trained to observe, recognize, collect, appropriately document evidence that ultimately becomes foundational to establishing the legal causation and responsibility for traumatic injury is the importance of forensic nursing. Why forensics? Violence as a healthcare issue. The health consequences of violence have become one of the most pressing problems in health and safety and require a multidisciplinary approach. Today, forensic nurses are recognized as previously untapped resources in anti-violence and a critical link in the administration justice. Due to the increased number of violent crimes in our society, the need for certified advanced practice nurses is more prevalent than ever. This team includes death investigators, correctional nurse specialists, forensic psychiatric nurses, legal nurse consultants, forensic gynecology nurses, and sexual assault examiners, both adult and pediatric certifications. Education is an associate's degree in nursing, bachelor's degree in nursing, or some even obtain Masters of Science in Forensic Nursing. Specialties include death investigators, legal nurse consultants, sexual assault nurse examiner, advocates, forensic nurse hospital-based experts, risk management, forensic mental health consultants. Based on the individual and the track taken to receive a nursing degree, once licensed, one must achieve expert skills in detail-oriented, critical thinking, compassion, patience, and have great communication skills. Florida nurse practitioner requirements need to be active licensed in the state of Florida to practice professional nursing, current and unencumbered, National Advanced Practice Certificate at an accredited or approved nursing specialty board, complete a formal specialty training program in the area of expertise, pass the American Nurse Association Credentialing Center Nurse Practitioner exam, and have a certification after passing a written exam. Responsibilities of the forensic nurse. They will develop and promote and implement protocols and systems responding to victims and perpetrators to trauma, injury, accidents, neglect, abuse, exploitation, and all forms of violence. Fields of responsibility for advanced forensic nursing include accidents, trauma, crime, victimization, violence, abuse, neglect, and exploitation. The advanced practice forensic nurse will impact research and affect human responses to violence, injury, trauma, accidents, neglect, abuse, exploitation, and all forms of victimization. Advanced practice forensic nurses try to prevent and reduce adaptation to crime, violence, and trauma, as well as other forms of victimization among communities, groups, and individuals. They promote caring as a value in the forensic setting. The advanced practice nurse will help develop and supervise systems of care for complex health problems related to accidents, trauma, crime, victimization, abuse, neglect, exploitation, and all types of violence. The advanced practice forensic nurse will educate others in the concept and practice of forensic nursing and forensic health, and be positive role models. Education goals are related to forensic nursing responsibility and can be used for different areas and communities of interest: forensic clients, nursing, healthcare providers, policymakers, and the public. The main responsibility is to care for the patient using the nurse process before all else, but in forensic nursing, your patients are the victims or perpetrators of crime, trauma, violence, abuse, There are standards of care and practice and are published in the Forensic Nursing Scope and Standards of Practice, updated in 2009 and updated version available in 2015. Standards of practice in accordance with your state practice acts. Standards of care include nursing first, preserving the evidence, if any, cooperating and abiding by the law, specialty training, and maintaining objectivity. Advanced practice forensic nurses do have a professional organization. They are the largest is the International Association of Forensic Nurses. They can receive credentialing through IAFN or ANCC, which is the American Nurses Credentialing Center. IAFN provides conferences and nursing journals to keep the profession growing and ever learning. There is a portfolio credentialing process and membership fees and education to maintain professional certification. The websites for the IAFN is the most forensic specific and gives credentialing information, mission statement, education and purpose for the practice, and can be found at iafn.org. Forensic nursing credentialing can also be found on the American Nurses Credentialing Center at nursecredentialing.org. Advanced forensic nursing skills usually come into play after a crime has been committed or suspected, and what we learn from the physical and psychological aspects can help improve overall patient care and safety. Impacted patients can be a flight risk, suicide risk, and can need watch or care from crimes of retaliation. What we know can protect these patients from continued or further harm to themselves or others. Health promotion focus includes abuse prevention programs, abuse protective programs, community awareness programs, and rehabilitation programs. Healthcare reform is the impact of healthcare reform on the role of the forensic nurse has greatly improved. Improving Justice Forensic Science, the Physical Defense Authorization Bill. It establishes requirements relating to sexual abuse, sexual assault forensic examiners for the armed forces, meaning that physicians, ARMPs, nurse midwives, PAs, and registered nurses are eligible for assignment in the military for SAFEs. The quality of care is always patient safety first, compassion, critical thinking skills, attention to detail, and evidence collection. These are our references that we used while doing this presentation. I hope you enjoyed it. Thank you.